Hello, my name is Mandela and welcome to Mandela Unveiled. This is a channel where we unpack all issues health related. We unpack all the social issues, the political issues, the environmental, whatever issue that impacts your health that you might not even be aware of. We discuss everything right here on this channel. Make sure to like, subscribe, and leave a comment in the comment section for any issue or topic you want to discuss, and we'll delve deep into that. In my previous channel discussion, I talked about medical tourism. Today, we're going to talk about brain drain. Brain drain basically talks about the movement of professionals from mostly less developed countries to countries like the United States, Canada, and Europe. This has been a phenomenon going on for a long. In recent times, there has been lots of migration from Africa to the United States, Canada, and Europe. For instance, statistics show that every month about 500 nurses leave Ghana to a destination country in the Western world. Between 2018 to 2022, more than 3,000 nurses left the shores of Ghana. Between 2021 to 2022, over 7,000 health professionals left Nigeria. In the same period, about 2,400 left Zambia, 2,400 health care workers, that is nurses and doctors alone, from Zimbabwe. And the WHO list of countries where nurses and doctors migrate more from Africa, Nigeria tops the list, followed by Ghana, Kenya, Zambia, Zimbabwe, and the list goes on. And according to WHO, 55 countries are at risk of healthcare shortage. In fact, most of these countries are on WHO's red list. And 40 countries out of these 55 countries are from Africa. And these healthcare workers migrate to UK, US, and other developed countries, not just because they want to, but research has shown that there are certain pull and push factors. And the push factors is because, one, healthcare in Africa is underfunded. Two, the remuneration is very poor. Three, there are no opportunities for professional development and growth. And the pull factors is because of the remuneration in the US and other countries, the opportunities for their kids to have better schooling, a better lifestyle, and what have you. In fact, statistics show that about 65% of Egyptian doctors were working abroad. Also, in the United Kingdom, statistics show that about 66,000 of all health professionals were from abroad, a majority from Africa. In 2015, during the Ebola outbreak, there were more doctors in UK of Sierra Leonean and Liberian origin than doctors who practice in Liberia and Sierra Leone. Liberia had only 51 doctors, serving a population of 4 million, while Sierra Leone had a little over 100 doctors, serving a population of about 6 million people. That is roughly about 0.1 and 0.2 per 1,000 population. This situation is so deplorable. This situation is unacceptable. And this migration happens, or this brain drain happens, because there's a lack of investment in the healthcare system in most African countries. The healthcare system is in deplorable state. Staff who need certain equipment to work are frustrated because they cannot have access to those equipment. Doctors who want to perform surgeries and be recognized globally cannot perform such surgeries. And most of these surgeons who travel abroad to the US, Canada, US, are hailed and recognized because they have all the machinery to exhibit their skills. Well, in 2010, the WHO member countries met to enact a code of practice on the recruitment of international nurses or medical workers. And this code of practice indicated that countries should engage in bilateral agreement to make sure that, for instance, if US is recruiting nurses from Ghana or Nigeria, then they should help the country to replace those healthcare workers and to also kind of like help them fund the training of more healthcare workers. But even at that, will these countries provide the opportunities for the medical workers or the healthcare workers in their countries? In Egypt, a medical doctor, average monthly salary is $120. When such a medical doctor immigrates to Saudi Arabia, for instance, they can receive as high as $2,140 a month. And those who have more experience or are specialists can receive about $6,000 a month. Just imagine the disparity. Averagely, I can speak confidently about the nursing situation in Ghana. Nurses in Ghana have received averagely about $130 to $300 a month, when they can receive higher amount of money if they immigrate to countries like Canada, US, and Europe. Recently, the government of UK realized that this was a trend, and they decided to review their guidelines on the recruitment of healthcare workers from most developing countries. But the bigger question here is, and when UK reviewed these guidelines, their main aim was to be able to come into some form of bilateral agreement with the various countries so that they stop recruiting from countries that are on the red list, WHO red list countries, and which talks about shortage of healthcare workers. But the bigger question here is, even if the UK stop recruiting these healthcare workers, and with these countries facing shortage of healthcare workers, are these countries in the position to employ their own healthcare workers? Last year, December, in Cote d'Ivoire, over 3,000 unemployed doctors went on a peaceful march to ask the government to employ them into the government sector. About 49 of these doctors were arrested, and some of them sentenced to 4 months. Why would a medical doctor be arrested, unemployed, just for peacefully walking on the streets of his or her country seeking for employment? Recently, the government of Ghana, when the Minister of Finance, Ken Ofori-Atta, read the budget, the government had put a freeze on employment. So the bigger question here is, even if UK reviews its guidelines and stop recruiting nurses, these countries are not ready to even employ their own healthcare workers. Ghana has a backlog of nurses out there who still have not been employed. And even those who are employed are paid between $120 to $300 a month. And some do not even get paid regularly. So, would anyone blame, or would anyone put the blame on these healthcare workers migrating in droves to the US, Canada, and Europe? Besides, the COVID-19 pandemic has come to create a big hole in the healthcare worker resource in the developed countries. And they need more healthcare workers. And I think that the WHO Code of Practice on the recruitment of international healthcare workers, if they are going to apply that, then they're going to be so unfair to most healthcare workers in Africa. A typical example is Zimbabwe, that seeks to criminalize the recruitment of healthcare workers, or healthcare workers who want to leave the country to practice, for crying out loud. That move by the government of Zimbabwe, or whoever that is initiating this, is not only insensitive, but it does not make sense. They have the right, they've earned the right to move anywhere in this world. If you say they should not move, you are infringing on their fundamental human rights. They have the right to move. Because when you don't pay them well, they have families to feed. Surely no one would love to leave their country when they've worked in a healthcare system for 10, 20, 15 years. No. But it's conditions that make them move. And most of these doctors and nurses that move to these developed countries see how they are valued, they see their worth. Most of them have won countless and multiple awards. Nigerian doctors have been so wonderful. Ghanaian doctors have been excellent. Kenyan doctors have been marvelous. The list goes on. African healthcare workers are performing wonders in the developed world. And that is because they have the resources. And not only the resources, the remuneration make them feel happy. And once these healthcare workers go through all these conditions in their countries, they are not able to work peacefully because their mental health is affected. So, dear Zimbabwe Minister of Health, or whoever that is instituting such a policy, it is simply unwise. You can't criminalize the recruitment of healthcare workers, people who want to better their lives. The government of Zimbabwe, if you seek to criminalize recruitment of healthcare workers, don't you think that you have to also criminalize your work? Because recently there was an Al Jazeera expose where the government, in collaboration with that fake pastor called Hubert Angel, smuggled gold out of the country worth billions of dollars. If you want to better your lives, why are you being selfish? Don't you think that the healthcare workers deserve the best? The 3,500 doctors who are practicing in Zimbabwe now, what is their state of health? Their mental health? What is their state, their financial state? Your healthcare system is collapsed. Yet you smuggle gold out daily. I am not saying it. Al Jazeera exposed you. At least you could have put that money into the economy. Pay doctors well. Pay your nurses well. Then you can try to criminalize recruitment of nurses. But if you have greedy people like Hubert Angel, who is an ambassador at large, a man who is corruption personified in Zimbabwe, parading himself as a man of God, buying luxurious cars for his son who doesn't even know his left from his right, a child, while medical workers languish in poverty, and you still want to criminalize the recruitment of international nurses? African leaders, wake up. Wake up. And I bet you, even if these developed countries come to a bilateral agreement and they agree to pay these African countries or the Minister of Health in the African countries to help train more workers, they're going to embezzle the money. Because Africa has received a lot of funding from so many funding agencies. In fact, in 2001, the Abuja Declaration stated that every country should endeavor to commit 15% of their country's budget to the development of health. 2001, we're in 2013, 2023. How many countries? In fact, the Abuja Declaration, the country where that declaration was enacted in last year, 2022, only 3.9% of the Nigeria's budget was stipulated for health. That is a shame. And Nigeria wants Nigerian doctors and nurses to stay in the country? My God. There are a lot of nurses in Ghana unemployed. Doctors receive peanuts in Ghana. And the Ghanaian government would love nurses and doctors to stay. It is unfortunate that we have brain drain. It is unfortunate that 500 nurses leave Ghana every month. But hey, who can blame them? They are looking for a better future for themselves. They have realized that the African politician is so greedy, insensitive, so they have to take their own destiny into their own hands. Hence, the movement in droves. No one can blame them. No one can begrudge them. There are no opportunities for growth. I have worked in the health system in Ghana before. Once you make an attempt to upgrade yourself professionally, then some healthcare directors begin to hunt you like a hawk. They either cut your salary, they, they make your life miserable. The reverse is the case in Canada and US. So why won't these people travel? I don't blame any nurse or doctor for moving. If you get a chance, move. It is worth it. It is good. You can't work and get paid peanuts. $120, $130, $300 a month. That's peanuts. Yes, it is possible that the salary goes hand in hand with the country's economy and the pitch. Yes, but things have changed. African countries are taxing their citizens to stupor. They are taxing their citizens to death. Things are so expensive. Everything keeps increasing, but salary of workers. So if you say $300 for a nurse or a doctor is enough, yes, Ghana and US economy isn't the same. Absolutely, yes. But dear governments, after the COVID-19 pandemic, you are hiding behind COVID-19 pandemic, Ukraine-Russia war, and all other flimsy excuses to increase taxes, to increase fuel, yet you refuse to increase the salary of workers. My dear healthcare workers, in Nigeria, Cameroon, Ghana, whatever African country you find yourself, if you get the opportunity, do not let it pass, because you're going to die a pauper. You need to live a dignified life. Certainly, it's not everyone who wants to, in Ghana they say boga, or in Nigeria japa. But if you get an opportunity, why not? No one will blame you. The politicians come to Canada. The politicians come to US. The politicians go to Europe. Some go to Singapore. Some go to Japan, Korea, and the list goes on. Their sons and daughters attend school abroad. So if you are leaving the country, you are not doing a disservice to your country. You are only trying to better your life. It is unfortunate the WHO has to face some of these issues of healthcare shortages in Africa, but the healthcare worker is not to blame. The blame should go to the government. If we are going to go by the code of practice, the guidelines on the recruitment of international nurses and doctors and other healthcare workers, then we are going to do a disservice to these healthcare workers. Because even if UK, Canada, and USA, they are not going to recruit from the WHO red list countries, these doctors and nurses and other healthcare workers are not going to be employed by their government, because one most of the countries have borrowed themselves to stupor. And the IMF dictates to them what to do. A typical example is Ghana. They have put a freeze on employment. So UK, if you refuse to recruit doctors and nurses from Ghana, the Ghanaian government is not going to employ them because they have put a freeze on employment. Even those who have left the shores of Ghana, they have not replaced them. Meanwhile, we have a backlog of nurses and doctors out there who have not been employed. Recently, medical physician assistants in Ghana went on a peaceful march at the Ministry of Health and they were arrested. Just like it happened in Cote d'Ivoire, where 49 doctors, unemployed doctors, were arrested out of 3,000 doctors who went on a peaceful march. Please, when you get the opportunity, do not hesitate. I am in Ontario. In Ontario, the government has made nursing schooling free. The government will pay for it because they have a shortage of nurses. They pay your tuition, even the books. And before I left Australia, Australia had instituted measures where they cut down the price of the price of tuition for STEM courses. If you're going to do nursing, physiotherapy, anything that is science related, engineering, health, they have cut down the price of all those courses in terms of tuition fees. So more people can get into those areas so they can strengthen the healthcare system. This is wisdom. Some African healthcare directors or leaders know is to suppress upcoming young people who want to break through in the healthcare system. When you want to upgrade yourself, they just put all the impediments in your way. Please, if you have the desire to upgrade yourself, if you have the desire to work abroad, that fire in you, let no one quench it. I always say, no one can tell me what to do because I make my own plans and no one knows my plans. No one can tell me how to make those plans come to pass. It's only you. So to my colleague healthcare workers in Africa, don't hesitate. You are not doing a disservice to your country. If you want to move, I will urge you to move. It's not all rosy at the other side, but it is better. At least you would have a good retirement. At least you would be able to get good education for your kids. Just like the politician in Africa would bring their kids here for better education. Like they always say, a word to the wise is enough. My name is Mandela, and this is my channel, Mandela Unveiled. A channel where we discuss all issues that affect your health. If you like our videos, don't hesitate to subscribe, share, like, and leave a comment in the comment section. Tell us what you want us to talk about, and we will delve right deep into that. And we shall dissect the issues with all the evidence we have. Thank you so much. Have a lovely day. Bye bye.